Hi everyone, News Channel 5's Chris Conti here. We are with Mary Moore tonight and Sharon Barker, and we are talking about people trying to get coverage through healthcare.gov, in a process that is happening right now all across the country. 21-ish million people were covered by this last year. Before we open up the phones again, why is it so important for people to get coverage, just in general? I mean, you know, I think people a lot of the times don't realize they need this until they don't have it.
It's important because they're worth it. They're worth it. I mean, you want to invest in yourself. You want to make certain that if you have an illness, an injury, that you don't go bankrupt trying to pay for it. You have insurance, that you can go to the doctor. You don't have to worry about letting a small illness turn into something that's catastrophic because you just didn't take care of something so small. You want the opportunity to live your best life and be healthy. That's why it's important.
And I know, I mean, we did a pretty expansive story a couple weeks ago, and there was one gentleman we talked to who was a construction worker and had worked all his life. He fell off of the roof of his house when he was fixing something, and he got pretty seriously hurt, had some long-term damage, but he didn't have health insurance at the time. And so now, not only is he trying to, you know, be seen, and he's stuck living in this coverage gap, but he also is drowning in debt.
Yes.
I mean, and that's what a lot of people don't realize. We talked about this a couple weeks ago, that medical debt and medical bills are the leading #1 source of bankruptcy in the U.S. And it's if you know someone or have met someone who is in that situation and dealing with that, you understand why. Because they just keep coming and they don't stop. And people who, you know, like that one caller said, well, I'd go to the doctor, but I can't afford it. Well, a lot of people still go to the doctor, even though they can't afford it, and they get the bills, and the bills just keep coming and piling up in tens of hundreds of thousands of dollars in a lot of cases. And so that, I think, speaks to why this is so important.
Absolutely.
And because a couple $100s, or, you know, maybe $150 a month seems like a lot to a person, but, you know, $100,000 in debt is going to be a lot more than $150 a month.
Absolutely.
It's just, sometimes it's hard to see
It is.
ahead.
Peace of mind, that's a big one.
That comes with
That
being
peace of mind.
What, you know, we were talking about, so you know, if people want to sign up, they can do it online, or they can come and do it in person. Or talk about some of the advantages of coming in and doing it in person, because I know a lot of times people have questions about stuff.
Absolutely. I like people that come and sit down. We take our time. We go through. It's like very personal to them. What's important to you? Premium, out-of-pocket costs, deductibles. Let's put your doctors in. Let's see if your doctor is going to take this plan. What medications? Let's see. It's kind of like tailor-making a plan to fit them instead of just going to the vending machine and picking something. You're actually getting a personalized coach to help you process and navigate the Affordable Care Act as well as the healthcare marketplace. A lot of people may not be computer literate. Sometimes you can read a question one way and you think it's asking one thing, but we as the certified navigator know, well, no, they're telling you this, or they're asking you this, and they go, oh, if we weren't there, they may have answered the question totally wrong, which would throw their eligibility off. So it's really important to come down and speak with someone that's trained in it, that does it all day.
And physically, where can people go to?
We're all over the place.
Where are options in Nashville?
The libraries are a great place to find us. We're at the Southeast Library a couple of days a week on Wednesdays and Saturdays. We're at the Madison Library on Tuesdays. We're at Bellevue Library on Fridays, Bordeaux Library on Thursdays, Downtown Library on Wednesdays. So they can find us at their local library very easily.
You guys are all over.
We're all over the place.
Let's talk a little bit about what should people bring with them, you know, if they come to sign up. What do they need to have in terms of streamlining this process?
Sure. Well, you want to make certain that we have your correct address. Everybody who's applying for coverage, we need their date of birth, their social security number, the person that is on the application. We need the household income for everybody in the household. If you're an immigrant, we need all documents for like green cards or I-94s or whatever your naturalization certificate numbers. What else, Mary? That's pretty pretty much it. Bring your doctors, list of doctors,
list
and
of doctors, very
prescriptions.
important. If your employer offers you health coverage, or if your spouse's employer offers health coverage, information about that is really important. If you had a plan last year, information about that. A lot of people are getting letters with an estimate of their premium for 2017, especially if their carrier's leaving, like Blue Cross and Blue Shield. And we've seen that the estimates on those letters are a lot higher than what their premium actually ends up being once we update their information in the system.
Right.
So, but bringing all that, any mail you've gotten from the marketplace or your insurance carrier would be helpful.
Let's go to the phones. If people want to call in, 615-737-PLUS. 615-737-PLUS is the number. I believe we have Helen, who is on line 2. Helen, can you hear me? Helen?
Yes.
Can you hear me?
Yes.
And where are you calling from?
Williamson County.
Williamson County. And do you currently have health insurance?
Yes. However, I have to make a change.
You have to make a change. Okay. And where do you get your health insurance from?
It's through a private company.
Okay. And what's your question for the ladies here?
In this area, in Franklin or Nashville, I would like to know, I just turned on the TV when I heard one of the ladies saying that depending on the community you lived in, certain companies were better than others. And I wanted to know what companies would be recommended for someone who needs dental work, and also for someone with a rare diagnosis which requires a very expensive prescription.
Okay.
Kind of a tough call, but
Well, I mean, as navigators, we are unbiased as far as insurance companies. But what I can say is that on the marketplace for Williamson County, your two options are Cigna or Humana. All the plans on the marketplace, pre-existing conditions don't come into play. As far as your prescription, though, the different plans may have different formularies. So that's something that you'll definitely want to look into. It'll depend on the medication, but that's something that you can look up through the healthcare.gov tool pretty easily, and a navigator can help you with as well. And dental plans are sold separately.
Right.
Through the marketplace as well, and the dental companies are Delta,
Dental Quest, Humana has one, Cigna has a dental plan on there this year.
what
So
do
there's
dental
several.
plans typically run people?
It depends. I have seen them as low as $16 a month, all the way up to $50. You really do need to click on the details to make certain that major dental is covered, or if there's not a waiting period on there, or certain limits and exclusions that apply. So you do need to make certain you open up the details to see exactly what that plan is going to cover and what it's going to exclude.
Okay. We want to remind people to call in 615-737-PLUS. 615-737-PLUS is the number. We're going to take a quick break, and we will be right back after this.